Before I accepted the position, I was a little bit apprehensive because I had never served in the military or had never worked at a military installation before.
People have this fear of being attached to something. Well, what if I get deployed? And It's not the military at all.
The United States Army Medical Command is actively seeking the best and brightest healthcare professionals to join our team. As part of the United States Army Medical Department, the United States Army Medical Command has close to 40,000 civilian employees. Civilians shape approximately 54% of MedCom staffing. Under the Department of the Army, MedCom ranks as one of the best places to work. We perform as federal civilian employees working alongside our military counterparts. As a civilian employee, you're not subject to the requirements of such things as boot camp, military uniforms, deployments, or the normal military age restrictions. As a civilian, you will enjoy excellent benefits and the security of employment with MedCom.
I had several friends who had done civil service and said, you really need to look into this. This is a great opportunity.
You want to make a real difference? Help protect those that protect us. Opportunities exist worldwide.
I enjoy my job. I look forward to each day in coming in and working with the ICU team, making recommendations to the doctors and the residents and the interns. Anytime that I have a suggestion, it is looked at as educational. Anytime I have a question, it is looked at as an opportunity to expand and to teach. Anytime that I question something that is being done in an educational manner, there is always a two-way street of communication. I feel very comfortable and confident in finding out more information about the patient from the medical team so that we as a team can make an informed decision on how to best treat the patient. From a technology standpoint, I think the biggest thing is the availability of the electronic medical chart. I can quickly review through the labs as well as medications for the patient and be able to formulate a plan and make recommendations to the team.
Working for the Army as a civilian, I have had the opportunity to not only work on a #1 trauma center in South Texas, I've also been exposed to the challenge of dealing with amputee patients, burn patients, and I can tell you there is no comparison on the things that I learn day to day with my experiences that I have had before working as a retail pharmacist and working as a hospital pharmacist in the outside. Working as a civilian for the Army, you're not only in there working with the team of doctors and nurses and with the rest of the medical team, we're working together with organization and with structure.
Well, I love the Army system, first of all, and in my experience working active duty, I really found that the civilians were, very strong, and I had a lot of mentors as civilians, so I just felt like I wanted to transition my career in that direction. There is a lot of opportunity for advancements. There's lots of levels of jobs, unique probably to the civilian side. You are rewarded for your performance. If you're doing a good job and you're meeting the standard and exceeding it, it will be recognized, and you will have opportunity to grow in your job and grow in the organization.
I think there are multiple factors that appealed to me in terms of the civil service. I had prior service experience myself, and I really enjoy working with the military community. I have the same beliefs. I enjoy the patient population. Now that I'm out of my uniform, I can still keep my foot in the door, so to speak, for a cause that I believe in. And as far as my job is concerned, civil service has just offered me so many opportunities to work in my area of expertise. In what I like to do, I kind of got to find my niche. I get to do purely outpatient medicine, which is what I like to do, and I still get to have a family on the side, so I don't find myself resenting my job because it doesn't take me away from my family.
I was familiar already with the hospital and the clinic that I was looking to apply for the job in, and I was also very familiar with the patients that we took care of. And these were patients that either had served selflessly, willing to make sacrifices of themselves, or their family members who also make sacrifices so the soldier can serve, or retirees in a similar situation, or the families of those retirees. I always found that type of care very rewarding. The opportunities are excellent. I have an opportunity to do both in and outpatient care without having to drive across town. There are so many physicians I know on the civilian side that have to cover 3 or 4 hospitals that so much of their time is spent on the road. I don't have that road time. I have time with my patients, and that's why I became a physician.
In my particular career field, the laboratory, it's extremely technical. The manner in which the technology is presented is constantly changing, it's constantly evolving, it's getting better. There's always something new to learn. And every military facility, to the best of my knowledge, is a teaching environment. It's a learning facility. The individuals that I work with, by and large, are well motivated. They're educated, they're technically proficient. They're good at what they do, and there are an awful lot of things that have to be taken care of every single day, and we have to rely on each other.
Now, our laboratory is certified by CAP, which is the College of American Pathologists. Our blood bank is certified by AABB, which is American Association of Blood Banks. And then with the population that we work with here, whether it's burn patients or it's our warriors in transition, we're always cutting edge, so we will compete with the outside, no doubt.
I had so many different opportunities professionally to do so many things that I wouldn't have had the opportunity to do otherwise. Traumatic brain injury is a new service for the Army, and we really have a big responsibility and a big opportunity to really learn new things and develop new things and help with how we should take care of people the right way, and helping all of these different young men and women who come through here with injuries. I think it really gives us an opportunity to see our patients from 360 degrees and to anticipate problems that they might have and to really care for them completely. I think we do things the right way, and we've had a lot of support to do things the right way. I have an incredible team of people working for me, and we get an opportunity to really take care of the whole person.
Coming from a civilian hospital to Brooke Army Medical Center has been a very rewarding change. It's a very unique environment because it is such a focused group of individuals that you are taking care of. They're very focused on patient care, they're very focused on teamwork and helping each other out. You see everything from really intense traumas to cardiac studies to lots of very focused studies looking for certain organs and different pathology within the organs. They are pretty much at the cutting edge of medicine with the scanners that are currently in use and the new ones that they're putting in. The cardiac CT, it's pretty much on the cutting edge of CAT scan and radiology. It's a way for a cardiologist and a radiologist to non-invasively look at someone's heart muscle and the vessels that kind of feed supply of blood to the heart without having to go into a big surgery suite and cut them open and do things. It's something I've never seen on the civilian side. I mean, they do it, but it's not nearly as frequent as what we do here at Brooke Army Medical Center.
The most rewarding day for me is every day that I come to work, I feel extremely proud of what I'm seeing and witnessing. And by that I mean even the small gains and small progress that some of our patients see on a day-to-day basis. I mean, that's why I came into the profession of occupational therapy, is to witness and to make change in an individual's life. You know, working in the Army Medical Department at the rehabilitation facility that I work at Brooke Army Medical Center, we see a lot of polytrauma. And what that entails is it's not just the amputation, it's not just the burns, it's not the orthopedic injuries, it's not the blindness, it's not the traumatic brain injury. A lot of times it's all those diagnoses rolled into one patient, which makes a very complex rehabilitation case for that clinical provider. The Center for the Intrepid, which is one of the most advanced rehabilitation facilities that we have in the world right now, we continue to complete evidence-based research to ensure that we are continuing to develop our practice areas and our level of care that we are providing to each and all of our service members that we come into contact with on a daily basis. And having the accessibility to some of the advancements in prosthetics that we've seen over the past few years have been really exciting, and to work hand in hand with the prosthetist, which is unheard of basically in the civilian sector. And I have the opportunity to come to work and work with some of the best people, the best individuals in this world that are willing to sacrifice life and limb for our country. That means a lot to me, not only because of my experience in prior service, but just the connection that I feel with that population.
It's a good place to be employed. They take care of you and they really care about what's going on. You really have some of the best equipment available on the market, and you've got a really good team of people that are there to serve a very important part of the population, and that's very rewarding.
I work side by side by active duty military, both from the Army and the Air Force. It is great and humbling to work with these individuals.
We're vital in maintaining continuity for those deployed soldiers. Maybe you would be asked to increase your responsibility in times that maybe that deployed head nurse or deployed supervisor is absent, and maybe taking on extra duties and tasks and become that, you know, consistent continuity of care person in that absence.
It's not quite a calling, but it's more of a belonging. It's where I feel comfortable. I feel like I can do them a good job, and I feel rewarded for being a part of it.
I didn't realize, you know, having come out of the military and having free everything, free healthcare, free this, free that, you know, how much that kind of stuff costs. The plans that they offer with civil service are about the best I've seen. You know, we've got great health care for my family now with really very appropriate rates.
The benefits are great. You have lots of time off.
You begin earning vacation and sick leave from day one. Unlike many organizations, it's available for immediate use.
The retirement benefits, for me, having done 7 years of prior service, I mean, to be able to walk into a job and take those years and put them towards my retirement is just, I mean, that's a blessing to me.
They do TSP matching, which is our thrift savings program. So if you're looking at like a 401k, they do matching with that.
The United States Army Medical Command offers very competitive salaries and benefits, which include annual and local pay adjustments. In addition, employees are eligible for recruitment, retention, and relocation bonuses up to 25% of their salary. Eligibility for paid moving expenses is also a plus. Moreover, employment with MedCom affords career growth through job advancement opportunities and increasing responsibility. Employees are not only tenured after 3 short years of service, but also gain highly marketable skills through experience and opportunities for job mobility. Additionally, there are many MWR or morale, welfare, and recreational activities. For example, several installations offer fitness centers, golf courses, bowling, recreation centers, horse stables, and craft centers, to name a few. You will also find many family-friendly and youth-oriented activities. These include daycare services, youth centers, sports activities, concerts, tours, and get-togethers exclusively for post personnel. You want to make a real difference? Help protect those that protect us. Opportunities exist worldwide.
You know, my initial perceptions found that the civilians that I had worked with when I was in the military, they were interested in making a difference. They were interested in providing the best possible care they could. They were interested in improving their own knowledge base. And that was actually one of the things that led me to want to join the Army Civilian Corps.
If you have a drive, if you have a sense of wanting to do more than just your average citizen, this is a great place to start.
If you're seeking a valuable, gratifying, and exhilarating career opportunity, look at the U.S. Army Medical Command.